My name's Jeanette Naschke. I'm a physician assistant. I work here locally in San Antonio as an urgent care provider. On May 4th, 2015, we did what we normally did, got in the car, headed up I-35, but that morning we didn't make it all the way to New Braunfels. I came up over a hill on I-35, and without me knowing, there was an accident right over that hill. And it wasn't enough time for me to stop my large SUV in time for me to get that car to completely stop. I came over that hill going 65 miles an hour, and so I went from 65 to, like, I hit him going about 60 miles an hour. So I have two boys, ages 5 and 3. My oldest is Austin, and my youngest is Nolan. They're really great kids. And I knew that if I hit that car straight on, the boys were going to feel the force and they were going to be injured in the back seat. So it crushed me into the car, and so my legs were up underneath basically the undercarriage of the car, and so it kind of snapped my legs and it snapped my arm. The steering wheel did. And so what ruptured my spleen was basically the driving the wheel. So the wheel crushed me up into because I went towards it. So I woke up initially from that accident and called for them. I couldn't move enough to see them in the back seat, and they didn't answer me. I kind of gave up because there was a thought in my mind that if I killed my kids, I don't want to be here anymore. I don't want to have for the rest of my life deal with that incredible sadness. So I basically went to the place where it was this peaceful place, and I kind of shut down, and then emotionally and physically I gave up. And if it wasn't for a man that got out of his car and he reassured me that the boys were okay and he had gotten them out of the car and they were fine and there wasn't a scratch on them, and that's really what kept me going, and that's what really revved me back up, and that got my fight going, and that I told myself, look, I'm gonna make it out of this car, and that's what I did. So when I got to BAMC, and this is all coming from what people have told me, because I had a pretty significant head injury, so I don't remember a lot of it. I had lost a lot of blood at this point. I ended up getting 27 blood transfusions to try to basically fill me back up from what I had lost. I needed over 30 hours of surgery, abdominal surgeries, leg surgeries, arm surgeries, a lot that I needed in order to get me back and put me all back together. I didn't really wake up, and I don't really remember much of anything until I was in the intensive care unit, and that was super daunting because I'm a physician assistant. I usually am on the other side, and I'm treating the patient that's in the bed. And to wake up in an ICU, not remembering what happened, and to look over your bed and you see all of these IV drips hanging, you see nurses working on you, you see physicians, you become the patient. And that's a very humbling experience, and one that I'll honestly never forget. So prior to my accident, Brooke Army Medical Center was a place where the soldiers went, and I didn't really know that they did much for civilians. And I always thought it was a place where if you had military background, that's where you would go. And I never really thought of it as a place that would be a haven and a hope for civilians. And since the accident, I've really found that they take great care of people like me and others that need help. In my situation, where I'm dealing with high impact injuries and I'm dealing with life-threatening injuries, I'm so thankful that I was able to go there, because I really honestly feel that if I wasn't able to be a patient at Brooke Army Medical Center, I really feel that I would have a prosthetic leg. There's no doubt in my mind that they did limb saving for me that day. We waited a little bit because, first of all, at the CFI, you're in there with the best of the best. You've got physical therapists from all walks, and they've been and they've seen a lot. And it was daunting, scary, because could I do it? There's all these things that kept going through my head. You know, the fact that I even had to relearn how to walk again. I mean, everything. Had to relearn how to use my arm. Had to relearn how to walk again. I had to relearn how to have a normal life. It was very scary. And so there was about 2 or 3 weeks in between moving out of the rehab hospital and moving into our home, where I basically did exercises at home. And they weren't much. I mean, I couldn't really do much. But I'll never forget the first day that my husband was wheeling me into the CFI. I checked in the front desk, got in the elevator, rode up to that 3rd floor, and the doors open. And there's 3 patients there, all amputees. And they all welcomed me. And they said, "Welcome, what's going on?" And the first question was, what happened to you? What's going on? And I saw these men taking life and getting their life back. And I told myself right there at that moment, if they can do it, I can do it. So the CFI has not only been fantastic for me physically, but what it's done for my emotional side and my strength and my character is more than I could even tell you.